It is. Can you hear me? Can those online hear me?
Yes, I can hear you.
Okay. Are you not able to hear?
Yeah, I can hear you, but it didn't seem like it was coming through.
Okay. All right, we're gonna start with our Pledge of Allegiance. Is Don C on? Okay, then, would you lead us, Ken?
I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
I know we've got proof of notification, so that takes us to approval of our, I believe, 25-point agenda.
Make a motion to approve the agenda.
All right,
Second.
motion by Renish. Second by Cindy.
Cindy or Tim, whoever.
Okay, all those in favor, please say aye.
Aye.
Any opposed? All right, I will also need approval of the previous meeting minutes. Hopefully you all had a chance to look over those. Does anybody have any corrections or comments before we approve them?
Move for approval.
All right, motion by Tim,
I'll second.
second by Mr. Van Landijk. All those in favor, please say aye.
Aye.
Any opposed? Okay, public comment portion. Is anybody here or online from the public that would wish to speak? All right, hearing no response, we're gonna move on. I am gonna say that the things that are more our regular topics on this agenda, I'm gonna try to move through fairly quickly because we have a few discussion items and bigger items that are gonna take a bit of time and hoping to keep our meeting time within a shorter amount of time. So number 7 is one of those bigger, or newer items, I guess I should say. Responses to the referendum ad hoc committee questions. So Supervisor Murphy Lopez had sent us back a list of questions from that committee once we sent forward our proposal. Oh goodness, was that 2 weeks ago? Yeah. So now we need to have some responses, just kind of clarifying questions, and Director Clements is going to go over that.
So I'll just go through the questions first. He had just questions about the acronyms that were used, so I did outline that for him.
And we're on number 7, by
I'm
the
sorry,
way.
yes. So it's the responses to the referendum ad hoc committee questions. Second question was in regards to the maintenance fee for the electronic health record system. That answer is a yes. He had a question about the elimination of the APS crisis worker. Even though the position is listed as 82,000, there's only a savings of 27. The remaining funds are covered by other programs. So we receive adult protective service funds yearly. We also receive crisis funds, and we can bill for the crisis, for some of the crisis contacts that we have. So although there's only 27,000 in levy, the remaining portion of that position would be covered by state funding or billable funding. Had questions about the restructuring of the behavioral health clinic and the savings there. So our mental health therapist positions have been or will be changed to the mental health case manager positions. The mental health case manager positions are primarily funded by Medicaid through the CCS program. So that does free up base county allocations that can be paid for, that can be used to pay other positions. Additionally, if we do not contract with Southwest for the service facilitator positions, we won't have to pay them that administrative fee. So those funds could be used strictly to fund the position and not to have that overhead with Southwest. There was a question about eliminating the Children's Long-Term Support Program. We are not eliminating that program. There has been in the past a maintenance of effort, so we had to put funds in, county levy into the program to get the remaining funds from the state. The state no longer has that requirement for us, and so we are able to fully fund that program through the Medicaid billing that we are able to do. Had questions about treatment courts and CST. Those are pretty similar to the APS crisis workers. So we receive a base amount of grant funds from the state to have those two positions. And we have to supply either, I believe it's a 20% and a 25% match. And so if those positions would have been eliminated, because the CST program will be saved, treatment court is still on there, we would only be losing the match portion, if that makes sense. So that's levy that we wouldn't need in the future. The rest of the program are provided by grant funding. He had questions about moving the nutrition program to the ADRC to provide a cost savings. If you'll remember, we added additional levy into that program. So there isn't that large cost savings. The cost savings of moving nutrition to the ADRC is about $5,000, but we added extra funds to maintain the nutrition program post ARPA funds running out. So we did, I guess, adjust our levy that we received to make sure that we're able to maintain the program at the level it's at right now. It talked about the day-to-day impact of a $10,000 reduction in the transportation program. The transportation program funds we receive each year is around $120,000. We have about $26,000 in levy into that program on top of the 120. So we are making a reduction to the levy that is contained in that program to make sure we're having enough to meet the match that's set by the state or the DOT for those programs. Question was on who is going to be taking over the Wisconsin Home Energy Assistance Program. It will be Energy Services Incorporated. They are a private nonprofit in the state of Wisconsin that Wisconsin contracts with, and they began providing this service in September of 2022. Next question talks about the county borrowing money to comply with court-ordered child and adult placements. And had questions on the statutory language and legal interpretation that allows for this. So as far as we know, there has not been another county in the state that has utilized short-term borrowing to pay for placements. Barron County is in the process of investigating to see if that would be an option for them. We are also looking into that. And if you see the attachment from Atlas Law Office, that references the statutory language on how we can do that. The next question talked about our staffing level and comparing us to other counties and really looking at what will our levels be at the end of 2027. And so I did answer that question there. I think it's very, very important that we remember we cannot compare Richland County Health and Human Services with other counties. If you try to compare us to Iowa County, they are a social services. They don't have the ADRC in their program. They don't have any of the behavioral health clinic there. Some counties don't have behavioral health clinics at all. Some counties, their treatment court is outside of HHS. So it's really important to remember that we cannot compare apples to apples. There really is an apples to a candy bar comparison because each county provides different services. They talked about the overages in 25 and 26 and asking about what the thinking is behind that. It was very hard to put together this long-range plan and looking at how meeting that total amount in the end. So we looked at it even more this past week when working on these answers. And so say we kept treatment court, it eliminates that overage for the 1 year, but then the next year, we don't meet our requirements. And so we're really hoping with, even though we're over, this might allow us some flexibility in the future that maybe we will have some ability to save different programs pending the revenue sources, the grant funding that we receive from the state. I think one of the things that we've talked about throughout is if there is funding in there and we can make it work, there are programs that we can save down the line or different things that we can keep going or maintain. The question was then next about, have we assessed the reductions in grants and other revenue streams if certain cuts are made? And then can we describe them in each of the relevant lines? What I believe he's asking for there is, so say we eliminate treatment court, does that eliminate other additional funds that may potentially come with that program? when we looked at each of the different recommendations that we're making, the cost of that overhead that we may receive will not be more than eliminating that position. So we're really not losing any funds, with less positions, less staff, there's less overhead that we receive, but there's also less expenses. And so those are things that we really took a look at when we're making that determination. And our last question was to provide the updated chart based on HHS and veterans combined, and so we did submit that to them. Are there any questions from anyone on this?
I have a question on number 8, the transportation program. I'm a little bit confused. It says we're lowering the levy amount to the amount of match required. Do you mean that we were originally requiring more levy than we needed for match?
Yes, we had more levy in the program than what was required.
What was the reason behind that?
So I think the biggest reason for that is match can either be in cash, like levy, or it can be in in-kind services. I think the mandatory amount was put in there in case if we didn't meet the in-kind match. So the in-kind is through volunteer time of, people that do volunteer work for us. So all the volunteer drivers, their time is counted as in-kind match. I think that the full amount was budgeted in case if we weren't able to meet that match.
So then are you looking at like past how much we get from in-kind and then lowering the levy?
Yes.
Okay, that makes more sense. Thank you. Any other questions? Yes.
I have one question. Did we recommend borrowing money for placements at all? And if we did, how is that saving anyone?
So it's not in our recommendation, but it is something that is being explored right now. We would utilize short-term borrowing to pay for the placements, and I'm going to try to explain it as best I can. My understanding of how short-term borrowing works is it is approved to borrow a certain dollar amount. It gets borrowed, that amount is added on to the property taxes that we receive. And so it's not county levy, is county levy because we're receiving extra county levy. But it's I guess a different way to.
Well, it allows us to basically increase the tax levy beyond, so there's limits on how much we can increase tax levy, if I'm saying this correctly. So short-term borrowing, because you're doing that for, say, that year, is a way to
Circumvent.
basically be able to get the money that you need for this without actually increasing our base tax levy.
So you're just getting more income
Right.
essentially from a tax levy without
Exactly.
tax.
Yes.
Different.
Without exceeding the tax levy limits that were placed upon us. That has never been done, as it was stated, for the purpose of this, but it's being explored in another county, so the question came up.
But we're gonna pay interest, so it's actually costing.
I don't actually know, I mean, for this specific instance, like for us paying for treatment court, I don't know how that would all work out. That would wind up. Because we haven't explored that.
Right, right.
The county does it every year. And, because I just asked the same questions, we approved, I think,
1.5.
1.5 million. And I was told, well, we just do that every year. Well, I'm like, we had $20,000 in expenses on generating the bond or whatever, the interest and stuff. I'm like, that doesn't make sense. Well, it's a way of circumventing the levy limits, and it's money we need. So they do short-term borrowing every year.
Yeah, so we're circumventing the limits by paying the interest for as a cost.
Exactly.
Madam Chair?
Yes, Mr. Seep.
Yes, thank you. Count me present, please. I was a little late getting in. I was having a lot of computer trouble here. Yes, may I comment on the short-term borrowing question?
Thank you.
Yeah, it's a very effective way to handle our cash flow, and it's money that's borrowed, and when the taxes come in the spring and March, we generally pay it back. Sometimes it's for a longer period of time, but we pay it back with the income from taxes received from the taxpayers, and it does not increase the levy. to the taxpayers. As someone said, it's a way of circumventing increasing the levy on the taxpayers. And it's a very efficient way of a very efficient tool for managing our cash flow, and it's very common practice among counties. Could you hear me?
Thank you, Mr. Steve. We did. Thank you. Been a
Mhm.
little off topic, but yes.
Thank you for clearing that up.
Yeah, you're welcome. I guess one last comment I would say is I believe, if I'm stating this correctly, Tim can correct me, is that the short-term borrowing that the county has been doing has been specifically for capital improvements, because those things were getting pushed back and were winding up costing more money in the long run when we couldn't fix buildings or do maintenance that we needed to do. So that was one of the reasons why we landed on short-term borrowing.
There is a special exception for placements and also for insurance purchases. Otherwise, it's generally restricted to capital expenditures. But there's an exception in the statutes for institutional placements.
Yes, so I expect that all the other counties will be closely watching what happens with, which county was it? Barron County, because many other counties are in the same position we are with difficulties meeting the treatment costs. Okay, any other questions on that? I don't think we have to take action in order to have you, but you're gonna send that on to the referendum committee, so
Yes.
everyone is good with that. Okay. Number 8, I apologize because there's not something in your folder. I have an email though that I can read kind of the relevant information. But discuss personal use of county property. This came from the Rules and Strategic Planning Committee, I think 2 months ago. We've been looking at our county-wide ethics ordinance and kind of revising that to cover county board members as well as employees. Because what we had before was kind of leaving out county board and referring back to the statute. So we're trying to make the language a bit more clear. Along with that, let me pull up my email here. The one thing that we were looking at was that our ordinance does not have any guidance on employees or officials' personal use of county property. Now, we know that there are some departments specific policies on the use of county property. But we've been specifically looking at several counties' ethics ordinances. And so the one that we were looking at was Crawford and Sauk County, and it does have guidance on this topic. I'm going to read their language and then explain what we wanted you guys to discuss. So the language from the Crawford and Sauk County says, an official or employee shall not use or knowingly permit the use of county services or county-owned vehicles, equipment, materials for unauthorized non-governmental purposes or for unauthorized personal convenience or for profit, unless such services or use are available to the public generally and consistent with practices and policies of the county. So we're trying to get input on this. Do we need to include this? If we do include this, is it going to impact policies you may already have in place? What we don't want to do is create more difficulty for departments that may already have some established practices with it. We're trying to get a feel for that. For example, we know like law enforcement has kind of their own policy for whether their deputies can take home squad cars or not, and highway has some for some of their trucks. So for HHS and veterans, we kind of need to hear from you if that's going to impact anything you guys do.
No, it shouldn't impact us at all. We do have the vehicles through the ADRC. Our current policies are state that we cannot use them, people cannot use them for personal use. So there should be no impact there.
I think the only other question I would have would be like laptops, because I know you guys have those for at home sometimes, but I'm assuming you guys already have policies about whether they're for work or person. I don't know how that works. We just wouldn't want to put a burden on.
So we don't have any policies outside of what MIS has.
Okay,
We are working on a phone policy, and in there, we're just saying the cell phones can be used for incidental use. So there are times that they might be out on a call, their cell phone is dead, they don't have service there, that they may need to call the office to say, hey, can you, or call home and say, I'm not going to be home on time. But we really did say for incidental use. And laptops, we follow the policy that MIS has.
Okay, thank you.
We don't have cell phones. Our laptop, is strictly used by office staff, except for when it comes to, veterans benefits. Sometimes veteran has to appear over the teleconference for Zoom meetings, and, during claims, and then also, when they have to do a Zoom meeting to Washington for the appellate court out there, so anything. And it's usually us setting it up so they don't physically touch the
Okay,
equipment.
so the one that we had the example there, if we had adopted similar language, it wouldn't impact that.
Correct.
Okay. And can I just have you repeat that? You said the ADRC has vehicles, but they have their own house.
Yes, they have their own policies related to the vehicle use, and in the policy, it states that the vehicles cannot be used for personal use.
Okay, all right. Any other questions from other committee members? Is mine not working? Oh, I died.
Madam Chair. Madam Chair, I don't know whether you can hear me.
Sorry, Don, my mic died. I'm back. I don't know what you guys didn't hear. We were just clarifying some of the.
No, I could hear. I could
Okay,
hear.
good.
But I had just a relational comment. There are some nuances to that policy as regards some of the other departments in the county. For example, over the years, you've heard people complain that they saw the county truck stopping at Quick Trip, and they thought that was inappropriate. But the department has a policy that allows them. They're out on the road, they're taking breaks, they're plowing snow, and that kind of activity was permitted. You have other departments with people with government vehicles doing their work out on the road, may have to stop and use the restroom, whatever the case may be. But there are some nuances to that policy in other departments.
Yes, I would agree. And I think the intent behind this, which is, I think, difficult to communicate clearly, is not to micromanage. It's basically to cover bigger ethical concerns where, something might be used, like it says, for profit or for. So that's why we're trying to get this input, because we don't want it to wind up in a micromanaging type of way. More just addressing any possible ethical concerns that might crop up. So thank you for your input. I'll relay it back to the committee at our next meeting. Okay, number 9, 2022 VSO budget summary.
We had a few expenses this past month, but besides that, there's been nothing out of the ordinary, out of the budget. The hotel rooms for Hugo and I for my continuing education and his accreditation.
Okay. Any questions for Ms. Knox? I think we've had her explain it a few times. I kind of view this as similar to the HHS budget. Just ask questions if you need some clarification. Does anyone have any questions? Okay, if not, we'll move to 10, your admin report.
In your folders, you'll see I posted something, the HR 4601. I spoke about it during budget season, and I just wanted to keep you guys updated. It did pass the Senate by a huge majority, which is awesome. And it's now going to be sent to the House. So I'm still tracking that and just want to keep you guys in the loop that federal funding, it'll be $50 million per year for the first 5 years. Competitive grants, I would definitely be applying for. So we did 2 outreach. We did Salvation Army Ring the Bell. It was okay. It was not as cold as some other days. And then we also did the Rotary Lights as an office with all of the donation going to the DAV van for transporting veterans. So besides that, Hugo will be his probation will be up next month on the 17th. And he has just started getting into the federal system. He's now on the register for federal being accredited. He's being recognized. He's not accredited, but he's being recognized that he's able to be accredited. I don't know how to say that, if that makes sense or not. So, but that's it. If anyone has any questions.
Thank you. Okay, if there are no questions, we'll move on. Number 11, the monthly visitor log report. Again, I think that can be informational only unless somebody had a specific question on the documents. It would be number 11 in there. There is a copy of the walk-ins and a copy of forms.
I think this got put on the agenda as an error, which isn't a big deal because it's going to be shared again next month anyway. So that's why I never, inquired about it, because it's really no big deal to share it. So.
Okay. I mean, I think if it would be reasonable for you, we could kind of include it in with your budget summary, just as informational, then you don't have to go over it. It's there if people have questions. Would that work for you? And we don't have to actually discuss it unless someone has a question.
We had spoke about doing it quarterly or maybe annually, so I just didn't know where we landed on
Yeah.
that.
I mean, I guess we could discuss that right now as a committee, like, would that look like you actually talking about it at those times? And then, we still have it in as informational, or do we want it? We don't want to see this in our folders every month and then just have it quarterly. I can discuss that right now if you guys would like.
The information is available at any time. I mean, on a whim, anyone could email me and say, can you send me this? But to me, I think that quarterly would be good. I've got a little bit of shyness towards the folder because it fills up so quickly. We've had some meetings where there are a lot of things in the committee folder that's.
Right, but it would be it would be a consent form where we wouldn't necessarily discuss it, similar to how they have in HHS, there's placement reports that are stuck in there every month that we can view as a committee on our own, but we don't actually discuss it. So I don't think the amount in there is a big deal. I guess I'm just curious what all of you would like, but thank you.
Madam Chair, I would be all right with quarterly, but no less than that, because it's a way of us looking at trends.
Sure.
So,
Okay.
I did, speaking of trends, I completely concur. And if you look at the reports that I've listed in there, I just wanted to clarify, the 2021 numbers that I put under so that you could compare. The reason it's yellowed out on both of the forms is because we had not started keeping track yet.
Okay, thank you. for
Just as a clarification. So, we started one of the forms in March of 2021 and the second one in April of 2021. So that's why those are blanked out. I just wanted to clarify that.
Thank you.
and this is not a form of micromanaging or anything. When budgetary times come around, people are gonna look at this and say, well, what are they doing? So it's important to track what you're doing.
Mhm.
Everybody else can see it through, the people that pass through the door and the services we provide. Well, this is the only way service office can see that.
Mr. Van Linde.
Thank you. I agree with what Ken said, that I think we should probably do this quarterly because it's a better idea as to what the trends are for that particular time of year. And one other thing I wanted to ask of Karen, how is Hugo doing? What is his background? Did we cover this before? I don't know too much about him. Is this his first stint as being a veteran service officer?
Correct. He has spent some time with the Department of the Army Human Resources. So he has quite a history of some of the forms that you would have to deal with Army retirees and Department of Defense retirees, Air Force and such. And he was working with the Afghanistans in Fort McCoy before he came to us.
Okay, I had the opportunity to go up and meet him, and he seems like a good fit, so thank you.
All right, well, if I don't hear any more input, then I guess That sounds great to me. We'll move to having that on the agenda quarterly instead of every month, and then you will just need to upload those at that time. Okay?
Thank you.
All right. That takes us to our consent items for Health and Human Services. So we have number 12 is the expenditures report, 13 is the budget summary and placement report, and 14 is the contract monitoring report. I did look over those. I guess I would ask if committee members have questions or if anybody from HHS has some clarifications they want to make on any of those. Okay. If not, then we'll just keep moving on to our action items, which is number 15, approve HHS contracts, agreements, and amendments.
Is it on?
Yeah.
Okay. So we have, we have two, one for 2020. See anything? So.
There's a little.
It's tiny button.
Hard to find.
There you go.
I know.
Have it on.
Okay, there we go.
Try doing it with my fingers.
I know.
Okay,
There you go.
there we go. So we have two listed. It's the same provider, but one is for 2022 and one is for 2023. Looking for just $1,000 each. We'll need separate approvals, so I can do one contract right now, actually, and then one with the turn of the new year for this placement for child and youth services, individual being served by that unit, silver living home treatment is what we're looking for. So
All right, need some motions unless somebody has a question first.
So move, we approve that.
Okay. Second,
In fact, that would be both, wouldn't it, or?
we're gonna do them separately. So for the first one, we have Francis for the second. And so all those in favor, please say aye.
Aye.
Any opposed? Okay, and so then the second motion there, we'll need a second item, we need a motion.
I move that we approve the second item as well.
All right, Ms. Sticker and Mr. Gotchall, all those in favor, please say aye.
Aye.
Any opposed? Okay, thank you. All right, number 16, approve the removal of the Comprehensive Community Services, CCS, Coordinating Committee member. I'm going to let Tricia read through that and explain a little bit, and then I know we also have Ms. Arneson here to make a comment.
So there has been a recommendation made by Clint Langra, the administrator. I will read his letter. I'm recommending the removal of Edie Arneson from her current appointment to the CCS Coordinating Committee. I have concerns of a conflict of interest based on Ms. Arneson's position of employment and have determined that a removal of service on the committee is in the best interest of the organization. I'm recommending support from the Health and Human Services and Veterans Standing Committee by action to recommend and confirmation of this action by the Richland County Board by vote. And this is something that I do support too.
Thank you. Edie, you can step up to one of these mics here. We've got an available one. Yeah, that one's fine. Thank you.
Yeah. Oh, okay. Okay.
Sorry about that.
So I've been going back and forth with this since October for the October HHS board. I'm not sure how my current employment is a conflict of interest, so I would like more information on that.
I don't specifically, yeah, I don't know Clint is. Sure.
Edie was a previous employee of Richland County Health and Human Services. During that time, she worked with us. She was in the CCS program. She then went and worked with Kickapoo Counseling, and in that transition, many employees also left and went to work for Kickapoo Counseling. We do have concerns of a potential conflict there with employees leaving after cases may have been after services may have been funneled to the department. So we are concerned, to that agency. So we are concerned by that.
Thank you. Mr. Arneson, I don't know, I mean, I don't necessarily think of this as a question and answer time. I guess if there was a statement that you wanted to make, then we would take that into consideration.
So I would like to say in regards to that, there was no funneling of cases. It says right in 36 that clients have the preference of who they'd like their providers to be. It was all client choice. I do have another client right now that I know she reached out to her CCS team and would like me to work with her again. And I know that that facilitator is working on getting a side service off. I don't know where that stands. But all the clients that I worked with, again, when I was a provider with the county, they wanted to work with me. There was no funneling of clients. And as far as county employees coming to Kickapoo, they came and said, do you have any work? There's nothing I can do if people that were former county employees come and say, hey, do you have any work for me? There's nothing I can do in regards to that.
Can I ask you what your interest is in being on this committee?
Absolutely. I have worked with CCS for now almost 5 years with Richland County. 8 months before that in Sauk County. I am a Richland County resident. This is my community. I would love to support the Richland or the CCS program.
Are you currently serving any members of the county?
I serve mental health services in Richland County, yes. And I still am on the contract with Richland County,
What contract would that
the
be?
CCS contract. I just currently don't have any clients.
So through the CCS program, ED is credentialed to provide services to Richland County residents. We had received an email from ED, I believe, 3 months ago that had requested to not serve Richland County clients anymore. And so that was another thing in our decision to not have her on the committee anymore because she was making the decision not to serve clients anymore.
Okay,
My position on the committee was mental health and substance abuse advocate for the community.
even though it is called a CCS committee.
Mhm.
Respect that as well. Okay, well, thank you. I appreciate your comments. Take that into consideration.
Madam Chair,
Yes,
can I get a little more clarification? So Kickapoo Counseling is currently contracted for services.
Yes, through the CCS program. Yes.
Okay. Assuming other providers other than Ms. Arneson could provide counseling at any time.
Correct.
all right, any other questions from the committee? Or discussion? If not, then we would need, this is an action item, so we would need a motion to recommend and confirm this and forward it on to the county board.
I have one question.
Yes, Mr. Seep?
Has this been reviewed by our corporate counsel?
Yes, it has.
Thank you.
Okay. Mr. Van Landijk, do you have a question?
I would ask, what is corporate counsel's opinion on this?
They have given us the recommendation that if this is what we feel between the administrator's office and HHS to be in the best interest, that this is the process we need to take to do this. I think the other thing that I really want to add here is we've gone through a few months of influx at HHS through our behavioral health unit. I started in July. Miranda left in August. We had bare minimum staff. We had Teresa, luckily enough, was willing to help us out in a pinch, and she was contracted before she was hired here. Never once did I get Edie to reach out to me to say, I know that you're short-staffed. I know you have people that, programs struggling. We had to contract out some of those services. Part of my decision in all of this was we hadn't seen that she had been a support as a committee member if she was dedicated to the CCS community. That's an assumption I was making, that she would have reached out to us.
Can I respond to that?
Madam Chair, I don't know, at some point in time, we possibly should go into closed session on this, because we're talking about employment issues, employee issues,
I don't know that this falls under the closed session since she's not an employee as of now. I honestly don't know the answer to that question. Ms. Arneson, I would say I would prefer that we not have more comments and back and forth at this point. I think we've heard from you, we've heard from, Director Clements, and we need to just kind of move forward with this. I know we had an email discussion back and forth as well, so there was that as well.
Madam Chair, I would agree. I think we are bordering on nudging up to the necessity for closed session, but I think we've discussed this enough that we can vote on it without further discussion.
Okay, thank you for that input. Do I have a motion? Or, yes,
I'll make a motion, I'd like a chance for commenting after a second too.
okay. So motion by, Tim,
and I would second.
second by Renish, discussion.
So my comment is, I think previous employees at HHS can make effective board members. Read between the lines on that one. The conflict for me is the current.
And speak for yourself.
The conflict for me is the current contract with the organization that Ms. Arneson is working for. Nothing Ms. Arneson herself.
Understandable. Any other discussion? Okay, if not, then I think we'll move to vote. Are we ready to vote? Okay, all those in favor then, please say aye. Opposed? Okay, the motion carries. We will move on. Number 17, approve the application and acceptance of a Walmart local community grant. This comes from Rose, it looks like.
And I don't know if you need anything.
Do you want to go to, maybe that one will be easier.
This is all. I don't know where it's at.
I didn't know if the members needed any additional information aside from the information or summary that was submitted. Our nutrition program became aware of a Walmart Community Organization grant that could provide anywhere between $250 up to $5,000 to support efforts to support our nutrition program in 8 different service areas. And upon discussing those service areas and the definitions of those with Tanya, our nutrition program coordinator, we thought that perhaps 2 or 3 of those particular areas could be those that we could support utilizing some funds from this particular grant offer. And so I would like to request the approval from the membership today to pursue that grant funding.
I would make that motion.
I would second that.
All right, we have a motion and a second. I just have a quick question. Maybe you already stated this. Is this something we've done before?
I think we have been aware of the potential for this, but I'm not aware, at least during the time that I've been working with nutrition program, that we've actually submitted a grant proposal to this organization.
Okay, thank you. Yes.
And there are no matching requirements or anything. It's a clear out and out.
As far as I'm aware, based upon what I've read and what I've discussed, I don't believe we have an in-kind match or any sort of obligation to support programming once this funding is exhausted.
Yeah, we used to, they changed the criteria on the grant, but the American Legion used to apply every year. And every store gets a certain amount every year to give back to the community. So it's a good deal. We're just not eligible anymore, otherwise we'd apply.
And it is, again, as Mr. Rennish indicated, it is actually administered or dispensed through a local Walmart store.
Thank you. All right, are we ready to vote? All those in favor, please say aye.
Aye.
Opposed? Okay, thank you, Rose. All right, approve the 2023 public health fee schedule.
To make the members aware that the information contained in this particular board summary, there was a typographical error. Upon utilizing last year's fee schedule, some of the verbiage in the narrative was not changed. However, I had initially changed the cost of TB skin testing fees from $12 to $15, primarily because the solution that we purchased is $11 per dosage, and we just can't, in good faith, provide a service where we are within $1 of the cost of just one component of that particular process. So I am requesting that we amend this particular board summary sheet to include the fact that TB skin testing will be increased in 2023 with the board's approval or committee's approval to $15 per test.
I'm sorry, could you state that last part again? You said there's a verbiage, the $12 is going to $15?
Yes, for
Okay.
TB skin.
TB
For the TB, for the TB test.
Right. Otherwise, the fee schedules for the vaccines will remain the same. Although I'll be honest with you, the prices for privately purchased Blue Zone high dose is creeping up very quickly. So we may have to reconsider that. Right now, $65 will be an appropriate total, out-of-pocket cost for individuals for that vaccine at this time.
Okay, thank you. And yes, Judge Barris.
So Rose, are we making money, losing money, or breaking even?
With the quadrivalent product for influenza, we should be making money on that. The dosages for that are range between $15 and $17 per dosage. For a Flu Zone or Fluorix, depending on which manufacturer you want to purchase from, it runs 15 and change and 17 and change. So the $40 out of pocket for folks, or with that, which is billed to third-party payers, insurers, usually we do well on. We are getting closer on the high dose. Right now, we think 65 will cover that cost of our time and the supplies necessary to provide that. But the prices for those have gone up from the $45 to $48 range, and it's pushing them to $55 to $57 per dosage on the high dose. And again, we privately purchased these for sale. There's very few options from the state of Wisconsin to get free vaccine, with the exception of school-age children. And we pre-book a supply of that every year because we really want to provide free vaccines, flu vaccines to school-age children, and we go to the schools and provide that. But otherwise, we don't have options for free vaccine. Otherwise, we have to purchase and sell it. So, but the TB, we're just getting way too close on that. We have been kind of swallowing it for a little bit, but we thought we just really need to move that ahead. And again, we want to do it incrementally so that it isn't so difficult for employers to send their employees or prospective employees to us for the pre-employment screening, or for those who come in for school-related purposes. Those are in healthcare professions, often need to have 1 or 2 step TB skin tests. So we're doing it incrementally. Again, we're really just under breaking even on that.
So I guess, Madam Chair, I would make a motion that we adopt the fee increases with an amended TB test up to $15.
Thank you.
I would second
By
that.
Reddish, second by Mr. Van Landijk. Any further discussion?
Yes, I had one question. I couldn't hear very well, Madam Chair. I noticed on the list here, and maybe you mentioned it and I didn't hear it. Are we continuing with COVID testing and vaccinations?
With COVID testing, even though I know it's a little diverting a bit or digressing, there were changes in the expectations from the state of Wisconsin that began October 1st, 2022. We were previously able to provide PCR testing, and those tests were sent to Exact Sciences for analysis.
What's PCR?
PCR is polymer change reaction. In other words, it would be a molecular test, but the state changed the testing criteria at the beginning of October to have us do antigen testing or a rapid test that folks are actually performing in their own homes now. And we thought that if we could distribute testing supplies, which we are doing, we do have free testing supplies we're able to distribute to individuals at different venues in the county. The difference in individuals testing in the privacy of their own homes and having them come to a test site to get the very same test, we just thought that was probably negligible. The benefit, and also our numbers had dropped to the point where supporting that and the capacity of both our emergency management and ambulance service staff along with public health on a 2-day per week basis made it a little less than optimal as well. So we have no longer been performing community-based testing. However, we do provide COVID vaccines at public health every week, Wednesday afternoons, and they're available at pharmacies and at the Richland Hospital Clinic as well for individuals. So there are several opportunities, but we do operate weekly in our office.
Do those continue to be free?
COVID vaccines, yes, are indeed free. They're a federal asset, and the supplies that we get to administer those are also free for us. We have chosen over the period of time that we've administered these vaccines to not charge an administration fee, although that was and continues to be permissible. For those who are uninsured, the federal government would support the administration fee, but that ended some time ago. But we chose not to do that. Partly, in fact, due to the capacity of the time and effort it would take our staff to do that.
Thank you, Rose. All right, I think we had a motion and a second before us, if I'm not mistaken. Okay, so all those in favor of the motion, please say aye.
Aye.
Aye. Thank you for your response.
Any opposed? Okay, moving on to number 19, approve the 2023 Behavioral Health Services fee schedule. And thank you, Rose.
Still on, right?
Hi, and welcome, by the way. I'm trying to remember if we officially welcomed you at our last.
I don't know. I'm Teresa Netherland, the Behavioral Health Services Manager.
Welcome.
Thank you.
Gotta close.
Yeah, you kind of feel like you're almost starting to eat it.
Okay. So the 2023 Behavioral Health Services fee schedule, it's the same as 2022. We reviewed 2020, 2021, and 2022. Really couldn't find the, so to speak, rhyme or reason behind the changes in the rates. So made the decision that this year we will keep them, or for 2023, we'll keep the rates the same, and then we'll just evaluate through this year just to see if we need to increase the next year.
Okay, so pretty straightforward. Any questions before we make a motion? All right, then I will accept a motion at this time.
Also
move. Okay.
I'll second.
All right, motion by Mr. Brathwaite and a second by Ms. Ruderstorff. Any further discussion? All those in favor, please say aye.
Aye.
Opposed? Okay, thank you. That takes us to 20, our admin report from our director, Tricia Cummins.
Okay, so I'll start with Children and Youth Services. Kaya Holtzman is currently doing her 5-day basic intake training. What this does is give her the ability to take children into custody with the approval of her supervisor. Brittany Wirtz has stepped into the role of the manager of that unit, with Jessica being on maternity leave and has been doing a good job of that. In clinical services, we have some new hires on the horizon, which we're pretty excited about. We've hired Savannah Ducharme as the substance abuse counselor position. She will be starting next week. She currently works at the Sheriff's Department, so we're excited to have her come to us. We are going to be adding every other week a advanced practice psychiatric nurse practitioner, Haley Schneider, and she will be starting on the 9th. On the 16th, we will be hiring therapists and some CCS case manager positions. We will have somebody transitioning into an APS position and having another case manager. So we're really feeling that that unit is getting the staff they need to provide all the services. Brandy Christensen, who is our treatment court coordinator, has completed the IDP training. So that is for individuals who have an OWI, and we'll begin to schedule these assessments in the next couple of weeks. So since Tiffany has left, that's a service that we have been unable to provide. So we're excited to resume that service. With our income maintenance unit, with the income maintenance unit, just wanted to report that the public health emergency was extended again. The one part about that being a good thing is if it wouldn't have been extended, we would have had extra work coming in January, which is already a very busy time. So now we're looking at the public health emergency possibly ending in April. When this does happen, the unwinding will begin and it'll be a very busy time. So what's going to happen is since the public health emergency has begun, everybody has remained on Medicaid. Once it is completed, we will have 12 months to review everybody who is currently on Medicaid and assess those cases. So that will be a very, very busy time for that unit. They will be most likely having to do some overtime so that we're able to meet the needs of all the individuals and making sure we're getting all of those done. It is believed that the consortium will be looking at and working on about 12,000 renewals each month during that 12-month time period. So it will be very busy for them during that time. And it'll be difficult for staff. You know, they'll be very busy. There'll be people who have had Medicaid for years that may be getting off of that program. And so they might be meeting some unhappy callers. And so we're really going to be trying to do what we can to take care of our staff during that time. In our ADRC, Medicare open enrollment ended yesterday, the 7th. This year was successful, and we had many individuals that were served both in person and by mail. Our transportation program was notified that the application for the 5310 grant was successful. This funding helps ensure access to food, medical care, and socialization activities to individuals throughout the county by offering wheelchair accessible bus routes daily. And the ADRC continues to see an increase in contacts across all programs. Contacts have nearly returned to pre-COVID levels. With our public health, respiratory illnesses of all sorts, COVID, RSV, influenza, are circulating locally and throughout Wisconsin. Staff continue to respond to COVID-19 infections. However, our COVID community level as identified by the CDC remains at a low level. Statewide, the RSV attack rate remains very high, but is beginning to diminish. Wisconsin is at a high level of influenza-like illness activity, particularly influenza A. And in the U.S., as of November 26, 44 states are experiencing high level of influenza-like activity. In the nutrition program, we're very happy to report that 6 volunteers will receive orientation on Friday, and they will begin to be able to provide home-delivered meals, and we are in the process of working on the 7th volunteer, so that's very exciting. As I said a little bit earlier, with staffing levels, we're getting almost fully staffed. That's really helpful. It cuts down on the overtime that staff have to have. It ensures that services can be provided at a good level. So we're very happy about that. I also just want to say a thanks to all the managers and staff this past 6 months. We've had lots of transitions, lots of ups and downs, lots of worries. And I just really want to shout out to all of them and commend them for staying dedicated, continuing to work hard, and continuing to do what needs to be done for the people of Richland County. So I really do appreciate that very much. That's it.
Thank you. Comments or questions? All right, number 21, is one of our bigger agenda items, is discuss the implications to HHS of centralizing human resources and finance, functions. So, there's a couple items, it's like 3 items in your folder. Do you know, was Clint going to speak to this at all today to us? No, okay. Well, I guess I'll let you explain if that's okay.
So one of the things that Finance and Personnel had recommended to Clint was to explore the possibility of an HR department and or a finance department. So this week at the Finance and Personnel meeting, he gave his recommendation. And it will have implications to the staffing level at HHS. So I really wanted to make sure that all of you guys are aware of it. If this were to happen, an HR department would potentially be created in 2024. We would lose 2 staff because those positions then would be absorbed into the HR department. We have requested the ability, of Clint supported that in the meeting, the administrator supported that in the meeting, to be able to give us some flexibility in making those changes instead of eliminating the 2 positions that cover those HR and payroll duties. And I think that's very important that we be able to have that authority as a department head to do that. It'll make sure that we can keep running the department as it needs to be run. The other piece of that is if they have a finance department, the proposal is 2 of the fiscal assistants would then transition into that department. And so there may be lots of changes that will be coming in the next few years. I think it's really important that if these things happen, that there's a lot of communication about the duties, where they go to, who's responsible for them. I have talked with the administrator and with Ingrid that if we are going to be losing 2 positions, potentially 4, it really is important that those duties go to those departments and are then brought back to our department or delegated to our department to do. We won't be able to do that with losing positions. And so there might be some fiscal implications that we'll have to talk about. I do appreciate that this is a long-range plan, and that's something that they're looking to do in the next couple of months.
So in your packets, I mean, I don't know how much you guys looked over this, but the 21A, the staffing study, if you scroll down, you know, this is still before, maybe Tim can speak to this a little bit, but I didn't listen to the last finance meeting, so I'm not sure where they landed on that. Clint, or Administrator Langrick, had made like 3 options as far as how this might look, which start for you guys on page 10 of 19 of that 21A. Could you just maybe update us on where you guys kind of landed on that?
Yeah, we took a hybrid approach, actually didn't support either of these 3 options. So the motion that I supported was, we advised Clint to create a finance and HR department with $100,000 cost savings to the county. No specific language about where the positions came from. Anecdotally, one of the big sentiments on that committee was, it appears that we're pillaging from HHS because it's easy, and we should look at other departments to see if there could be some sort of conglomeration of duties throughout the county through various departments that can be transferred to these departments. And so it's my understanding that Clint is going to retool his recommendation coming forward, but the $100,000 cost savings that's pretty important.
And that had not been included in the original language, like the specific cost savings?
There was, with the reduction of 2 HR staff from HHS, there was, I forget the exact number, a $33,000 savings or something of that nature. But the motion that came out of finance was $100,000 savings for the county.
Okay, so this 21A, the staffing study with the options, he's tasked to basically redo that and bring it back to your committee.
Right, and as such, it could look very similar to recommendations he's brought in the past, or it could not. It could include positions from other departments. I think there's still some latitude to make some decisions there on what his final recommendation is.
Okay, thank you for that. Tricia, did you want to talk about then 21B? I don't know. So Health and Human Services on the 21B, where it looks at the study and basically the impact of what might happen if we move specific duties over. Our department specific is on page 7, and then I'm not sure where veterans.
There was no impact to veterans. So
Okay.
here. Yep. So we really just looked at, so what the proposal was is that if 2 specific positions would be eliminated, how would those duties be absorbed within the department? So there would be about 3/4 of a position that would go to the HR department and payroll. The remaining duties would have to be absorbed by somebody else within the agency. And so those are the things that we looked at here, is how that would play out, how that would work, what those things would look like. And so on those pages, it really looks at, what would we do if we did. It really talked about, and what he would wanting me to do is if there were 2 specific positions that were eliminated. And so we talked about in here, supervision of administrative services, creating schedules, work assignments, performance evaluations, disciplinary action. If those 2 positions were eliminated and they weren't absorbed by somebody else, what would happen? And so we would need to still have somebody doing that task. And that's what we tried to look at here. Or if it didn't happen at all. So if we had no supervision, we would have staff without direction, and that wouldn't be a good thing. The general office maintenance function, the building repairs, inventory, ordering, payment of invoices, somebody would have to do that. We have to continue to do that preventative maintenance in our building. Our next task is the supervision of agency fiscal operations. That is something that is not completed by that position, so that would have no impact. Those HR functions would be moved, so there would be no impact to us there. The provider service contract monitoring, that's really important. We would have to have somebody there. We really have to make sure that we're staying within our contracts, that we're not overspending, so that is a task that would have to be absorbed by somebody else.
Can I clarify something with you? This was just in response to the 2 HR positions. So if they're doing a hybrid approach, this might change, correct?
Right, and if he gives us the authority to eliminate positions based on what would work best within the department, this wouldn't have any impact.
Okay,
And
so
that's,
this is just in case.
this is worst case scenario.
Okay,
Yeah. I mean, so to me, these are positions that I would make sure were absorbed by somebody else, or those positions continue and they would get other duties and we would make other adjustments within the department. So what I had proposed is that we would eliminate 2 to 3 positions, keep those current positions that he had proposed, to continue to have some of that cost savings provided.
okay. All right, so for our committee, I know this is kind of a lot, and it was a lot of information to digest. And I think we're going to hear updates once this comes back with a different model, but do you guys need any more information, or does this, I guess, somewhat make sense? Do you have questions? Yeah,
It does somewhat make sense, but I guess the questions I would have is, some of the duties that you were listing, Tricia, would normally be handled by either a department manager per se, not some other, or if the duties were centralized in a separate HR department for the county, and or a separate finance department for the county, many of those duties, maybe not most, many of those duties would be handled by that central office versus someone just within the boundaries of of your departments, correct?
Yeah, that is correct. Yes.
Rather than being maintained by someone or
Correct.
reassigned to someone in your building.
Yes, yes. It's those other duties that wouldn't fall under HR payroll that we would have to reassign.
So we're talking just HR and payroll, but not, are they talking about combining HR, payroll, and financial services?
So my understanding is HR and payroll would all be in a human resources department, and then finance would be a separate department. I'm not opposed to having a finance department. I just myself can't visualize how that would look, but I'm not opposed to that. It can present some issues, you know, with the plan to have a couple fiscal specialists transition. They are paid for partially by specific funding sources. So if they're not doing those funding sources, then we lose some of that money that's used to support that position.
We as HHS or we as the county?
I think we as the county, so if they absorb those two positions in that fiscal unit and they're doing other duties, there might be increased levy into that position versus, you know, the funding sources that are there now.
If I could ask another question, with this, maybe you already addressed this, with this, how does that, I know you said you're having a hard time visualizing, but is the suggestion that that would include all of the billing that we do that's very specific to some of those like grant and state monies and things like that?
We don't know for sure.
Do you know if there's other, I mean, I'm sure there's other counties that have a centralized finance department. Do you know, has there been any talk about how they parse that out?
I think Clint has talked with them. One of the comments that was made in the finance and personnel meeting is that people might still be housed within HHS and remain doing the same duties, but just report to a different person. So
Okay,
that might be the solution. I'm not sure.
okay. Yeah. Yes,
It almost seems like as if this is going to be an extremely convoluted change if in fact it goes through. If it goes through, as you've talked about, would personnel within your department be capable of absorbing those things? It sounds, you know, they've already got a full plate. Then for them to take on more and losing only 2 people and possibly losing funding for some of that goes on. I mean, I think there's got to be a little more thought and discussion here because too many things are too nebulous. It's just, you know, you can't kind of get your hands around it. It's just kind of mush. So I think we need more before we can go forward with any of this.
And I agree, and I appreciate that they're not in a huge rush to do this. I get 2024 isn't that far away, but at least it's not next month or even a couple of months away. We're really gonna start digging into our processes that we have here, see if there's some efficiencies that we can find. But I do worry if we have 4 staff that are gonna be out of our department, it could lead to some significant challenges to us, especially when you look at if somebody's on a maternity leave, if we have absences because somebody left the agency and we have to take time to fill those positions, medical leaves, there could definitely be some challenges there for us to be able to respond timely.
Madam Chair.
yes, Mr. Steve?
Yes, I certainly agree with the sentiments that Trish has expressed to us. I think we have to be very, very cautious. This project, in my view, is going to require a lot of careful planning and training of personnel. But preceding that, there certainly is going to have to be a good understanding of the task and duties of each of these jobs. There are distinct differences in the kind of bookkeeping and accounting work that is done in human services as opposed to another department. And it's very specialized kind of work. There's a lot of detailed time reporting that relates to billing for compensation from various providers. It is a very, very complex operation. It works very well, I think, at present. And my analogy is this. I recall some years ago, I instituted a computer program for accounting in the early 80s in my company, and rather in the company that I worked for. And it was a pretty large corporate operation. And one of the mistakes we made was a failure to provide the time to provide on a parallel basis for at least a year training and running the two systems. We failed to run the manual system parallel to the computer system, and we made a hell of a lot of costly mistakes, as did numerous other companies that I was aware of. So in this proposition, there's going to have to be a lot of side-by-side training for new personnel to familiarize themselves. And I do like the idea of leaving people where they are and just having them report to the finance office or to the human resource person for final disposition. But I think the rubber needs to be as close to the road as possible when we're dealing with such very, very important work, and just minor mistakes can cost us a lot of money.
Thank you, Mr. Steve.
Madam Chair, I have a question.
Yes,
Tricia, do you have one employee that is their sole job is HR?
No,
They all multitask.
there's one person who does HR, but she does many, many other tasks
Okay.
too.
all right, so I think, I mean, for us as a committee right now, we really will have to wait for more information. But thank you, because I think we need to have this in front of us, so we have some understanding. I guess one last quick question, Tim, was he supposed to have that hybrid option? Like, is that gonna be discussed at next month's meeting? Is that the plan?
So my understanding of next steps was it was going to go back to the ad hoc committee
Okay.
to formulate it into a referendum question.
Oh, okay,
Because not getting too far in the weeds, but the second part of the motion assumed that we would do short-term borrowing for liability insurance. And we came upon that number, liability insurance for the entire county. We came upon the number that we're proposing to the ad hoc committee based on a $100,000 savings from centralizing HR and finance.
Okay.
Since the two aren't necessarily related, but are mutually exclusive either.
okay, thank you. Yes,
Ingrid, I would agree with you that there's an awful lot more to be done, about this. And I guess the old adage comes back to me, if it ain't broke, don't fix it. It seems like HHS is one of the largest departments that we have as a county. And it's a well-functioning entity at this point. And if we were to do this, I think there's an awful lot more thought that needs to go into it before we kind of mess with it, because it may end up costing us more than we save because of the problems that might be created because of this. So time will tell. We need more though.
yeah,
Thank you.
yes, thank you. I agree. I do think, I guess my comment would be that this is going to create some complications and some difficulties for individual departments. On the other hand, we're also looking countywide. Are there efficiencies, and things that can happen if we look at doing this? So the balancing of all of those things. I apologize, but I need to take like a 5-minute break. I haven't done that even in our 3 meetings, but our 3-hour meetings, but
Second that.
okay, thank you. I'm gonna take just a 5-minute break, okay? Okay, we're gonna pick back up. Thanks, guys. That moves us to number 22, the HHS personnel updates.
Yeah, so there it is. So we have a few new hires, as Tricia alluded to earlier. Paul Baranski is someone that wasn't mentioned, but he is the new Spanish-speaking interpreter. That is someone that we can use on rotation, on call, for a lot of our birth to 3 and CLTS needs. Savannah Ducharme, substance abuse counselor. She'll be starting next week. A couple people are coming off probationary period, including Trish and Brittany Wertz. Then at the bottom there, we had some activity through the Southwest Workforce Development Board. Tiffany Olson had left us as our treatment coordinator. She was hired on as an LTE in October and then resigned just before Thanksgiving. So those are the updates that we have. Then you'll see, of course, the vacant positions below. And then I've bolded those that are on hold technically.
Thanks. Mr. Steve, did you have a question?
A comment.
Okay.
Just as a matter of information, I understand that our Veterans Benefits Specialist is a very accomplished bilingualist, and in the future, he may be considered a real asset to the county and to your offices. I don't know whether you are aware of that, but the county certainly needs that kind of talent.
Madam Chair,
Thank you, but I think we need to stick to our agenda. So we're going to move on to number 23, the quarterly review of the org chart.
Okay, so this has been updated as of October 1st, and I'll just go through and highlight the actual changes on pages. September 1st, there's lots of activity coming up in the next few weeks, so you won't see those people actually in here, but I'll mention them. As well, we have some in the hopper for January. So again, not in here specifically, they haven't officially been hired, but we are excited about filling some of those roles. So right on page 1, or page 2 technically, on the far right, you'll see the temp casual Spanish interpreters. We'll be adding Paul Bransky there now that he's started. No other change to that page. Flip to page 3. It's the ADRC. No change in the last quarter from what I've reported before. So go to page 4. Behavioral health, lots of activity here. So right at the top, just under Tricia, the bright yellow, there's Teresa Nundahl, who we've hired on since the last quarter as the manager of the unit. And again, swing to far left under the mental health outpatient clinic. There's activity there. We mentioned the substance abuse counselor. She'll be coming on. Of course, that's next week. So it's after the December 1st when this was, I updated this. So that'll be a filled position. Haley Schneider, left-hand side nurse practitioner. She has been hired as an independent contractor. And then since the last report, Brandy Christensen as our new treatment court coordinator. We are excited to, in January, have one of the mental health therapist vacant positions tentatively filled. Under the CCS block, blue block, right down the middle, Cindy Bromland is a new leased service facilitator. We are excited in January to more than likely have all 3 of those mental health case manager positions filled. Now listed as vacant. Far right, Children's Long-Term Support, blue block. Under Lori Cooey, we have now added a CST coordinator under her supervision. It's a leased position that was just added in September. I think that's everything on that page, but this will change definitely with names and more details the next quarter. Page 5 is our Business and Financial Services office. No change. Page 6, Child and Youth Services. No change there either. Page 7, Under economic support, we have had 2 new specialists filled alphabetically. That's how I run these. So it's Kaylee Wolf is been hired recently, as well as all the way down at the bottom, Sydney Meeker. So they filled the last 2 vacancies that we had for economic support specialists. And then the last page, 8, is public health. No change there either. I will point out what I did do to kind of help, visually to help with what's been grayed out on your memo of positions that are on hold. I then made them more of a striped block of vacant positions to kind of show that those are on hold, not any intention to fill at this point in time. So they kind of coordinate. Any questions?
Thank you for preparing that.
Yep.
All right, number 24, future agenda items. Anyone who has any agenda items or things they'd like us to add for next month? Mr. Van Landwehr.
One of the things I'm not sure it should be an agenda item, maybe this is something that Tricia, as Don was just saying, the new ESO officer, that's working with Karen. He's half-time. I think he works 20 hours in that particular office. So maybe that's something you may look into, to maybe take him on as part-time in yours. So I don't know if he wants to go full-time or not, but this is
I
something.
think that would be a discussion between Tricia and this isn't even going to be an impact until, what did we decide? 2025.
So just to bring it up as a possibility, because he's a fine young man,
Okay,
far
but
taller.
you were just talking about
far
agenda
taller than
items.
I.
Okay, I don't think we can put that on the agenda, but thank you.
Just leave it be, but this has been just a Tricia, so thank you.
Other agenda items though? Yes, Tim.
Are you talking about future agenda items?
Yes, Mr. Seat, but Mr. Gaucho is going to speak.
I'd like to keep on the potential centralization just as a reoccurring topic every month, whether we have
Then
things to discuss.
for
or not.
finance and HR. Okay. Sounds good. We can keep that on.
Good plan.
I have an item I'd like to put on the agenda.
Okay,
I think it would be very helpful to the committee and very nice to have to invite the new assistant or the new benefits specialist to our meeting and introduce himself to our committee and give us a little background in person. None of us, I don't think any of us have had an opportunity to sit down and visit with him. So I think that would be very nice to have him introduced to the oversight committees.
I appreciate that, Don. I would just say that Ms. Knock had offered an open house, and so many of the board members did actually attend that. I did as well and was able to meet Hugo with that. So that was a great opportunity to meet him and get to know him.
Well, I was not available that day, and I'm sorry that.
Not by any time. But thank you for the suggestion. Anyone else? Okay, I don't know if Carrie can speak right now. If you can, Carrie, and you wanted to talk, otherwise we can chat later. Carrie and I both attended the community health needs assessment, the last session that happened, and he had mentioned potentially speaking about some of those things, but I can get in touch with him. I don't know if he's got.
Actually, I was going to ask at one point in time, it might be good to just have a summary of what has been outlined to date, et cetera. I've also been part of that
Sorry,
process in the past, so.
Didn't mean to over.
I had a different
That was
hat on,
oversight.
put it that way.
I did actually see you there, so I apologize. The reason why I thought of that was because Carrie spoke to me at the time that he wanted to add it, so thank you.
Yeah, he's been very, very excited to be participating in that process, so.
Yeah, so we can, I can discuss with Rose what she thinks as far as adding some sort of informational item onto there. Okay, thank you. I think, if anyone else has anything else? All right, that takes us to adjournment. Our next meeting will be January 12th. That's not right. Okay, January 12th at 9:30. I have a motion for adjournment. Motion by Mr. Renish, second. Ms. Chicker.
Second.
Thank you. All those in favor, please say aye.
Aye.
Any opposed? Thanks, guys.